that is the other video lecture of the pharmacovigilance. This is a PSUR subsection cumulative subject exposure in clinical trials. Cumulative numbers of subject from ongoing and completed clinical trials exposed to the investigational medicinal products, placebo and or active comparator. Since the DIBT, it's recognized that for old products, detailed data might not available. More detailed cumulative subject exposure in clinical trials should be presented if available. For example, subgrouped by age, sex, and racial ethnic group for the entire development program. Okay, more detailed cumulative subject exposure in clinical trials should be presented if available. For example, subgroup by age, sex, and racial ethnic group for the entire development program. PSUR subsection cumulative subject exposure in clinical trials. Important difference among trials in those routes of administration or patient population can be noted in the tables. If applicable, all separate tables can be considered. If clinical trials have been or are being performed in a special population, for example, pregnant women, patients with renal, hepatic, or cardiac impairment, or patients with relevant generic polymorphism, exposure data should be provided as appropriate. If clinical trials have been or are being performed in a special population, for example, pregnant women, patients with renal, hepatic, or cardiac impairment, or patients with relevant generic polymorphism, exposure data should be provided as appropriate. When there are substantial difference in time of exposure between subjects randomized to the investigational medicinal product or comparator, or parties in length of exposure between clinical trials, it can be useful to express exposure in subject time, subject days, months, or years. Investigational drug exposure in healthy volunteers might be less relevant to overall safety profile depending on the types of adverse reaction, particularly when subjects are exposed to a single dose. Such data can be presented separately with an explanation as appropriate. Investigational drug exposure in healthy volunteer might be less relevant to the overall safety profile, depending on the type of adverse reaction, particularly when subjects are exposed to a single dose. Such data can be presented separately with an explanation as appropriate. If the serious adverse events from clinical trials are presented by indication in the summary tabulation, the patient exposure should also be presented by indication. Where available, if the serious adverse events from the clinical trials are presented by indication in the summary tabulation, the patient exposure should also be presented by indication, where available. For individual trials of particular importance, demographic characteristics should be provided separately. Estimated cumulative subject exposure from the clinical trials. Treatment, medicinal products, comparator, and placebo. Number of the subjects. Cumulative subject exposure to investigational drug from completed clinical trials by age and sex. Age, female or male, and total. See, estimated cumulative subject exposure from clinical trials, name of the product, number of subjects in the medicinal products, comparator, and placebo. And this one is a cumulative subject exposure to investigational drug from completed clinical trials by racial and ethnic group. Asian, Black, Caucasian, other unknown, total. Psur subsection, cumulative and interval patient exposure from marketing experience. Post-authorization, non-clinical trial exposure. Post-authorization use in a special population and pediatric population, elderly population, pregnant or lactating women. Okay, again, the PSUR subsection, cumulative and interval patients exposure from marketing experience. In the marketing experience, we have a post-authorization exposure, non-clinical trial. We have a post-authorization use in a special population. We have a pediatric population. We have an elderly population. We have a pregnant or lactating woman. Okay? We have a marketing experience. We have a cumulative and interval patients exposure. In this case, we have a PSUR or periodic safety update report subsection. We have a patient with hepatic or renal impairment. In the marketing experience, we have a patient with other relevant or comorbidity. We have a patient disease severity different from that studied in the clinical trials. We have a subpopulation carrying relevant genetic polymorphism. We have a population with a specific racial and or ethnic origin. We have other post-authorization use also. In this case, we should have a PSUR subsection. We have a data in summary tabulation. 561, it has a reference information. 5.62 have a cumulative summary tabulation of serious adverse event from clinical trials. 563 has a PSUR subsection, cumulative and interval summary tabulation from post-marketing data source. What is our data source, marketing data source? What was it? Reference information. This subsection of the PSUR should specify the version of the coding dictionary used for presentation of adverse event reaction. Should specify the version of the coding dictionary used for presentation of adverse event reaction. Cumulative summary tabulation of serious adverse event from clinical trials. Causality assessment, all serious adverse event and not just serious adverse reaction, and blinded and unblinded data. Cumulative summary tabulation of serious adverse event from clinical trials has a causality assessment, all serious adverse event and not just serious adverse reaction, and also has a blinded and unblinded data. Again, you see, we have clinical trials. We have a cumulative summary tabulation of a serious adverse events. Now we should assess all our causality, and we should collect all serious adverse events and also not just serious adverse reaction. Also, we should collect all our blind data and all unblind data. In this table, we should have a cumulative tabulation of serious adverse reaction. For example, preferred term, blood and lymphatic systemic disorders, anemia, bone marrow necrosis, cardiac disorders, tachycardia, ischemia, cardiomyopathy, and C is written such like medicinal product, blinded, active comparator. What is the active comparator here in the examples, and what is the placebo? Placebo for blood and lymphatic system, active comparator for blood and lymphatic system disorders, blinded. What is that medicinal product for this system organ class? Cumulative and interval summary tabulation from post-marketing data source. Cumulative and data and interval summary tabulation from post-marketing data source. Number of adverse reactions by preferred term from post-authorization source. Spontaneous included competent authority worldwide and literatures. Okay, in this case, in this tablet, we have spontaneous including competent authority worldwide and literature. Serious, interval, serious, cumulative, non-serious interval, non-serious cumulative. We have a total of the spontaneous, cumulative, and the serious again interval cumulative. Oh, okay, it's on the top of this is written spontaneous including competent authorities worldwide and literature, and in again where we go, and it's written here non-interval post-marketing study and reports from other associated source. What is the difference? You see, first we search from the literature, and then we studied from the post-marketing authorization, from the serious, interval, and cumulative. Summaries of significant finding from clinical trials during the reporting intervals. Summaries of significant finding from clinical trials during the reporting interval. A summary of the clinically important emerging efficacy and safety finding obtained from the marketing authorization holders sponsored clinical trials during the reporting interval. Information on lack of efficacy from clinical trials for treatment of non-life-threatening disease in authorized indication. A summary of clinically important emerging efficacy and safety finding obtained from the marketing authorization holders sponsored clinical trial. Summary of clinically important emerging efficacy and safety finding obtained from the marketing authorization holders sponsored clinical trials during the reporting interval. Information on lack of efficacy from clinical trials for treatment of non-life-threatening disease in authorized interaction. An appendix listing the sponsored post-authorization interventional trials with the primary aim of identifying, characterizing, or quantifying a safety hazard or confirming the safety profile of the medicinal product that were completed or ongoing during the reported interval. This is a summary of significant findings from the clinical trials during the reporting interval. The listing should include the following information for each trials. A study ID, for example, protocol number or other identifier. A study title, abbreviated study title if applicable. A study type, for example, randomized clinical trial. Population studies, including country and other relevant. population description, for example, pediatric population or trial subjects with impaired renal function. Study star as defined by the marketing authorization holder and projected completion date. Study ongoing clinical trial has begun or completed clinical study report is finalized. Okay, the listing should include the following information. Which list? The list of summaries of significant finding from the clinical trial should have a study ID of an identifier or protocol number, a study title, a study type, population studies, population description, a study star, a status, summaries of significant finding from clinical trials during the reporting interval, completed clinical trials, ongoing clinical trials, or long-term follow-up, for example, advanced therapy products such as gene therapy, cell therapy products, tissue engineered products is a long-term follow-up. Which type of clinical trial? Is a completed clinical trial, ongoing clinical trial, long-term follow-up? Other therapeutic use of medicinal product, for example, expanded access program, particular patients use, and other organized data collection, new safety data related to fixed combination and therapy. It's a new safety data. Okay, what is the new safety data to fixed combination therapies? If the active substance, that is the subject of the PSUR or periodic safety update reports, is also authorized or under the development as a component of a fixed combination products or a multi-drug regimen, this subsection should summarize important safety findings from use of a combination therapy. If the product itself is a fixed combination product, this PSUR subsection should summarize important safety information arising from the individual components, whether authorized or under development. If the active substance, that is the subject of the PSUR, is also authorized or under development as a component of the fixed combination product or a multi-drug regimen, this subsection should summarize important safety findings from use of the combination therapy. If the product itself is a fixed combination product, this PSUR subsection should summarize important safety information arising from the individual components, whether authorized or under development. Finding from non-interventional studies. Which studies we have finding? Observational studies, epidemiological studies, registries, and active surveillance program. Finding from non-interventional studies. Observational studies, epidemiological studies, registries, and active surveillance studies. This is a finding from non-interventional studies. B59 is information for other clinical trials and sources. Reports of asymptomatic overdose, abuse, use beyond data recommended in the reference product information or use in a special population via spontaneous reports, medical information queries, customers' complaints, screening of digital media, Other information sources available to the marketing authorization holders. Information of other clinical trials and sources. Reports of asymptomatic overdose, abuse, use beyond that recommended in the reference product information or use in a special population via its spontaneous report, medical information queries, customer complaints, screening of digital media, other information source available to the marketing authorization holder. Information for other clinical trials and source, other clinical trials and medication errors. Reports for asymptomatic overdose, abuse, spontaneous, other clinical and so other. Okay. Other clinical, maybe that is a spontaneous, maybe medical information, maybe customer complaints, maybe a screening of digital media we can. Other information source available at the marketing authorization holders, other clinical trial. Okay, the other clinical trials information of other clinical trials and sources, reports for asymptomatic overdose, abuse, use beyond information, and information for other clinical trials and sources, other clinical trials, medication errors, information of other clinical trials and source, maybe the other clinical trials. The other clinical trials could be a source of these other clinical trials. And the medication errors could be information of these clinical trials. Other clinical trial study and source, including patient support. Other clinical trials study source including patient support program, which are accessible by the marketing authorization holder during the reporting interval. For example, results from meta-analysis of randomized clinical trial, safety information provided by co-development partners or from investigators' initial trials. Other clinical trials study source including patient support program, which are accessible by the marketing authorization holder during the reporting interval. For example, results from meta-analyses of randomized clinical trials, safety information provided by co-development partners or from investigators initiated trials. Medication errors either medication errors or potential medication errors even when not associated with adverse outcomes. Psur sections 510 is a non-clinical data. Okay, again, in the Psur section for the non-clinical data, we should summarize major safety findings from non-clinical in vivo and in vitro study. For example, carcinogenicity, reproduction or immunotoxicity studies, ongoing or completed during the reporting interval. Psur section literature published in the peer-reviewed scientific literature made available as unpublished manuscript that the marketing authorization holder became aware of during the reporting interval. The publication reference should be provided in the style of the Vancouver Convention. Again, PSUR section literature published in the peer-reviewed scientific literature made available as unpublished manuscript that the marketing authorization holder became aware of during the reporting interval. The publication reference should be provided in the style of the Vancouver Convention. The special type of safety information: pregnancy outcome, including termination, with no adverse outcome, use in pediatric population, lack of efficacy, asymptomatic overdose, abuse or misuse, medication error, where no adverse event occurred, important non-clinical safety results. Pregnancy, a special type of safety information for pregnancy outcome, including termination with no adverse outcome, use in pediatric population, lack of efficacy, asymptomatic overdose, abuse or misuse, medication error, where no adverse event occur, important non-clinical safety result. Other periodic reports. This PSUR section will only apply in certain circumstances concerning fixed combination products or products with multiple indications and or formulation where multiple PSUR are prepared in agreement with the competent authority. In general, the marketing authorization holder should prepare a single PSUR for a single active substances unless otherwise specified by the competent authority. However, if multiple PSUR are prepared for a single medicinal product, this section should also summarize significant findings from other PSUR if they are not presented elsewhere within the report. This PSUR section will only apply in certain circumstances, concentration, fixed combination products or products with multiple indications and or formulation where multiple PSURs are prepared in agreement with the competent authority in general. The marketing authorization holder should prepare a single PSUR for a single active substances unless otherwise specified by competent authority. However, if multiple PSUR are prepared for a single medicinal product, this section should also summarize a significant finding from other PSUR also if they are not presented elsewhere within the reports. Lack of efficacy in control clinical trials. This section should summarize data from clinical trials indicating lack of efficacy or lack of efficacy relative to established therapies for products intended to treat or prevent serious or life-threatening illnesses, for example, excess cardiovascular adverse event in a trial of a new antiplatelet medicine for acute coronary syndrome that could reflect a significant risk to the treated population. This section should summarize data from clinical trial indicating lack of efficacy or lack of efficacy relative to established therapies for products intended to treat or prevent serious or life-threatening illnesses, for example, excess cardiovascular adverse event in a trial of a new antiplatelet medicine for acute coronary syndrome that should reflect the significant risks to treated population. late-breaking information. For example, a well-documented case of aplastic anemia in a medicinal product known to be associated with adverse effect on the bone marrow in the absence of a possible alternative cause. A well-documented case of aplastic anemia in a medicinal product known to be associated with adverse effect on the bone marrow in the absence of possible alternative cause. Any significant change proposed to the reference product information, for example, new adverse reaction, warning, or contraindication which has occurred during this period should also be included in this section of the PSUR.